together, and we have really been very much in tune as to what's happening, particularly in the pharmaceutical area and in the hospital area. And through the presentation that John's going to provide today, you'll start to see that the control that you may have is going to come back into your hands. So without further ado, I'm going to introduce John Augustine, who will now take us through the solutions that take us into the future of healthcare and what will be coming up as a way of cost containment and being very, very creative in our healthcare solutions. So John, taking it over to you.
Thank you so much, Rachel, and to the whole Saposnik team for allowing us to partner with you on this seminar. This is an awesome opportunity. And for everyone attending, we're thrilled to have this opportunity. As by way of quick background, Wellnet is a medical and prescription plan administrator that competes with the national insurance carriers. So we build health plans that look and feel just like the ones offered by the national insurance carriers, but we enhance them, and we're excited to share those strategies with you today. Obviously, you all are aware that offering a strong benefits program is critical to attracting and retaining employees. And what we've learned over the years, particularly in the last few years, as healthcare costs continue to escalate at an unacceptable and uncontrollable rate, that employers want more than what the big box insurance carriers can offer. So as Rachel alluded to, Wellnet builds plans in partnership with Saposnik and our consultant partners across the country that reduce claim costs for employers, reduce out-of-pocket expenses for members, and also improve the predictability of good medical outcomes. Those three things, win, win, win. The premiums that you pay as an employer for your medical and prescription insurance are derived from the cost of the claims. So Wellnet works with Saposnik Insurance to build health plans that lower the cost of claims, again, while simultaneously lowering the members out of pocket, which seems impossible. We're going to show you how to do that today. And then again, while simultaneously improving the predictability of a good medical outcome. And we can't lose sight of that. For your members and your own families, great medical outcomes is the single most important thing that we want when we're faced with a serious medical condition. And so we're thrilled to have this opportunity today. Before we get into it, we're going to start with this survey that Wellnet put on not too long ago, where we sent a bunch of self-funded questions out to consultants all over the United States. And then we've aggregated their response, and we're going to share several of those questions and answers with you today, because I think you'll find it very eye-opening. This question says, I believe working with the BUCAs, Blues, United, Cigna, Aetna, Humana, the big national insurance carriers, is best for my clients. True or false? Most consultants in the country said false. Today, as we talk, I think you'll understand why that is. But that's very, very interesting. If you look at the percentage of clients or employers in the United States that are self-funded, it's less than that. So consultants believe self-funding is the most viable option, but there's some reasons why most employers or many employers are not self-funded. We'll talk about some of them today. So what method of funding do you believe is in the best interest of your clients? Self-funding, 98% of the brokers said that. 98% believe self-funding is the right answer. Today, we're going to try and dispel some myths for you as to maybe some of the fears that you may have about self-funding and how self-funding can be used to create that win-win-win scenario I described. Lower claim costs, lower employee out of pocket, but better medical outcomes. The third question here is, what was your biggest challenge in moving an employer away from the fully insured market? Obviously, self-funded plans need to be underwritten. So the first response was a challenge for smaller businesses. 30% said they couldn't get their claims data and thus they couldn't be underwritten. Fear of change was the biggest answer, though. In life, you guys know, gals know, fear is what stops us. For those that sort of are always looking to better themselves, one of the most common themes you hear is step outside of your comfort zone. That's where we grow as human beings. That's where the opportunity lies for employers, for consultants, for everyone in the healthcare space. The moment we step outside of what we're used to, so many things become available to us, things we didn't realize existed. And so today we're going to, again, dispel some myths and show you some ways that you can start to take advantage of being self-funded. If your clients are fully insured today, why do they remain that way? The biggest answer was the perception that there's too much risk. For sake of conversation, isn't a fully insured renewal that goes up 10% per year pretty risky? There's nothing else in our lives that goes up that much. And healthcare is your second or third biggest expense. And so when it goes up 10 or 15% every single year in the fully insured market, that's a big risk to your organization. Self-funding includes stop-loss insurance. I think that this perception that there's too much risk boils down to one thing: a lack of understanding, a fear of something that we don't understand. So today's goal, if we do our job correctly today, is to help you understand that self-funding is not something to be scared of. It's something to be embraced. Sure, there's challenges, just like there's challenges being fully insured and getting a 10 to 15% renewal each year. But we'll talk through some of those challenges and how you can embrace them, how you can manage them, which is a key concept here. Self-funded plans give you the ability to manage the plan. It's a living beast. It can be managed. A fully insured plan, to say this in a funny way, is, you know, your consultant shows up 9 or 10 months out from the start date and gives you a few fully insured options. And you know that the only way to lower that renewal premium is to either switch carriers, raise deductibles, raise copays. You have very few levers that you can pull. There's no control and there's really no ability to manage it. Today, we're going to talk about how you can manage it. So what are the top concerns when employers make decisions about their health plan? The top one was cost. That's pretty obvious. The second one was service and responsiveness. The third being employee resistance. And then over on the right-hand side, and this one's sort of an illusion, which is an interesting, to me, an interesting part of this question. How much potential savings do you need to see to move to self-funding? And the overwhelming answer was 15%. Next was 10%. In the self-funded world, though, the reason I say it's kind of an illusion is you have this stop-loss insurance, which stops your losses at a certain point. So stop-loss insurance guarantees you'll never spend more than X amount of dollars. But many employers are focused on that number as their decision-making point, when in reality, the costs that you pay in a self-funded environment are really three things. The administrative fees, we'll talk more about this in a moment, the cost of that stop-loss insurance, but then the lion's share of it, like 70 or 80%, is claims. So if you want to spend less in the future in a self-funded arrangement, you have to control the cost of claims. And so what you'll hear today is how you can put a plan together that seriously controls the cost of claims while also reducing out-of-pocket costs for members, while also improving outcomes for families. And so you'll never hit that stop-loss max. Sure, it's possible that you'll hit it, but what we're really doing is hedging your bet. We're putting in all these hedges so that it's very, very difficult to ever hit your maximum costs in a self-funded environment. Control and manageability, two huge concepts we'll talk about today. This is a very important question that many on the call might not understand the opportunity in front of them relative to this question. If quality is the same between certain providers in the same town, in the same state, across the United States, if quality is the same, do you believe companies can save money by guiding members to different providers, lower cost providers? Lots of people, until you learn, like we're going to teach today, lots of people think that a claim is a claim. If I need a wrist surgery, it costs my health plan the same no matter where I go. So I'll just go where my doctor tells me. But that couldn't be further from the truth. One of the biggest illusions in healthcare today is that healthcare costs are the same no matter where you go. It's the same for the member, because the member pays their copay or deductible. But it's radically different for behind the scenes. What the insurance companies pay the doctor and pay the hospital is different at every single doctor and every single facility. And we're going to show you 3 different examples of that today based on the 3 of the top 10 most common high-cost health procedures. I'm going to show you radically different costs in Southern Florida. And then you'll realize the opportunity. If you're an employer trying to save money on your health insurance premium, which is derived from the cost of the claims, then you have to lower the cost of the claims if you want to lower premium. That's the general premise of today's conversation. How do we lower the cost of claims so that you pay less for premium, so that you can stop charging your people more and more each year, so you can stop raising their copays and deductibles? When Rachel and Sapoznik and Wellnet build plans, we lower the deductibles, we lower the copays, and simultaneously lower the costs for you as the employer. When asked if a consultant anticipates their clients embracing new delivery models, 72% said yes relative to high performance networks or narrow networks. 62% said yes relative to centers of excellence, and 54% said yes relative to direct contracting. Let me introduce the term direct contracting here because we're going to use this later. No network can dictate where you and your families can get health care. Just because a doctor doesn't participate in Blue Cross or Aetna or United Healthcare, that doesn't mean you and your family can't use that doctor. I think deep down you know that. All the insurance does is offset some of the costs. You and your family can use any provider you want. And if you didn't have insurance, you can call them up and negotiate a cash price. Well, isn't that interesting? Well, the big box insurance carriers, they've already done all that. They call it their network. But I want you to think about this. If you have a gabillion doctors in your network, do you think that you have much negotiating leverage when you speak with a new doctor? Because that new doctor is going to say something like, well, if you want the best possible costs for me, if you want me to give you the lowest possible costs, I need to know you're going to start sending members my way. But if I'm just another one of your gabillions of doctors, why would I give you any special pricing? Interesting. On the other hand, companies like Wellnet, companies like Sapoznik, we can directly contract with certain providers. So I can go to a provider in Southern Florida, for example, and say something like this. I'm going to steer members to you, Mr. Provider, because you're really good at what you do. We have the data to support that. So congratulations on being great at what you do. Every member I steer to you is going to have 0 copays, 0 deductibles, and we're going to pay you very quickly, faster than Blue Cross pays you. But in exchange for that, in exchange for me steering members to you, in exchange for the members having no cost sharing, you're not going to have to collect any deductibles. I need you to give us a really sweetheart pricing deal. That's called a direct contract. And we do that all day long. And you can use that type of idea to say something like this to your members. Here's your PPO plan with Wellnet. You've got the Aetna or the Cigna network. Wellnet mirrored the same plan designs that we had last year with Florida Blue Cross. So we've got 3 plans to pick from. They have the same copays and deductibles as last year, but we're doing one better for you. If you're willing to call Wellnet for any of your deductible items and allow Wellnet to guide you to one of their direct contracts or one of the providers in their high performance network, we're going to waive that deductible for you. You'll pay nothing, but it's totally voluntary. It's your choice. You can go to any doctor you want, pay your copays and deductibles. But if you're willing to make a call to Wellnet, have a conversation with them about the quality of the providers around you, and then use a provider Wellnet recommends, you'll pay nothing. Think about that. We've not taken anything away from your members, but we're now giving you as the employer the ability to pay significantly less for the cost of the healthcare that your people are consuming. And that directly correlates to the premium cost you're paying because your premiums are derived from claims. So using a direct contract, using a high performance network, on a voluntary basis, enables you to create that win-win scenario. lower claim costs for you, the payer, lower out-of-pocket costs for the member because we're removing their deductible when they use these providers, and a predictably better medical outcome for their families because we're only guiding them to the highest quality providers in the region. Really powerful thought, very powerful technique that the most progressive employers are starting to use. And this question here is showing you that the majority of consultants out there are thinking about this. They just need your buy-in. They need you to leave the big box carriers to start to take advantage of these ideas.
John, I just wanted to mention something here as well. With the trend over the last several years of employers moving their deductibles as their solution, we're seeing deductibles hitting $5,000 and out-of-pocket maximums hitting over $7,000. This is a way where employees who normally would not be able to afford their deductible have an opportunity to have the services they need with a zero deductible program. And more importantly, the doctors and the facilities have been vetted out. I think it's very important to understand that through the Wellnet model, the doctors, the facilities are vetted out and they're considered at the highest level. So we're achieving two very significant goals here. And the third one is to try to remove the fear factor of change.
Yep. The fact that it's offered on a voluntary basis to employees removes that fear factor. We're not forcing employees to do anything. This is about empowering you as an employer and empowering your people. Your people can't afford a $5,000 deductible. They can't afford a $3,000 or a $2,000 deductible, generally speaking. Over 60% of Americans have less than $1,000 in their emergency fund. And so imagine being able to attract and retain employees by saying something like, our health plans have options that have zero deductibles. That's really strong, and very few of the people on this line or any of your competitors can say that, because they're stuck in this hamster wheel where every year, as Rachel said, the costs keep climbing, the out-of-pocket costs for members. Now, we understand that change is challenging. That's why we're all comfortable in our comfort zone. But where we excel as human beings, and where you will find that you've excelled probably in your business over the years, is stepping outside of your comfort zone a little bit, pushing yourselves. Chris Orsman has been a longtime client of Wellnet's. This is almost 1,000 enrolled car dealership that we work with. And we recently had Chris on a LinkedIn live cast that we hosted. And we asked him why he stayed with Blue Cross so long before moving to Wellnet. And his response is probably familiar to many of you on the line. I was comfortable with the painstaking mediocrity of the annual renewal process. There's some strange fun to it, even though it's a terribly drawn out and laborious process. I mean, there aren't many options for you to consider. Your consultant shows up at the 9 or 10 month mark, shows you 4 or 5 fully insured options, might even tell you they looked at self-funding. It doesn't make sense for you, even though they didn't show you any numbers or didn't really describe the concept or why it makes sense. And so you have these 4 or 5 fully insured options, and you make a few changes. Maybe you negotiate with your current carrier, you renew, and you worry about it next year when your rates go up again. There's some comfort in that because you're used to it. But I'm telling you, the moment you step outside of that, the world is your oyster. Rob Wheeler from the Carlisle Group was also on that same live cast. And I'll just read you his quote because it says so much. Lots of people focus on the structural cost savings that self-funding provides, but it's so much more than that. It's an enabler of long-term healthcare strategies like the ones we just described in that survey. It gives you access to all your data. Imagine trying to run your business with no data. You'd fail. Your business will go bankrupt. And that's what's happening in health plans. You don't have any data. You're trusting a Blue Cross or a big box insurance carrier who's publicly traded to control your costs. I'm going to show you on the next slide why they're actually incentivized to raise your costs, which is mind-blowing to most people when they see what I'm about to show you for the first time. And then the last line here, control. It gives you control over your own destiny. In a self-funded environment, you can do whatever you want. And your administrator, like a Wellnet, and your consultant, like a Saposnik, make sure that everything you do is legal. So we put the bumpers on, like bumper bowling, right? We put the bumpers on the gutter. You can't fail. We make sure you succeed. There's two main reasons why the big box insurance carriers are never going to truly lower the cost of your claims. They have been telling us for 50 years how they're going to save us money. But have they? Every year the rates keep going up. No one's saving money using the big box insurance carriers. You know that from your own experience. But there's two key reasons why that's the case. The first is the MLR, the medical loss ratio that was part of the Affordable Care Act in 2010. The medical loss ratio says to fully insured plan administrators. So if you're a fully insured, if you're using a fully insured medical plan, the insurance carrier that sponsors that must pay out for groups that have more than 50 enrolled, I believe it is. It might be 100 enrolled. So mid-market and large group, the fully insured carriers have to pay out 85% of the premium charged in the form of claims. They can only retain 15% of the premium charged as their revenue. Obviously, an insurance carrier wants their revenue to go up every year, and they deserve that, just like you do at your business. But for them to raise their revenue, that 15%, they have to make the whole pie bigger. They can't raise the 15%. They're locked in at 15% revenue. So the only way that that 15% becomes bigger is if the whole pie gets bigger. They need the claim costs to continue to escalate so that they can charge more premium, so their 15% is bigger. For small groups, it's an 80-20 mix. 80% of the premium has to be paid out in the form of claims. They can only retain 20%. In either market segment, small, mid-market, or large group, the carrier is restricted to only keeping a percentage of the premium. So they're incentivized in a perverse way to allow the cost of claims to keep escalating. It's the only way they can make more money. The other thing is Wall Street. Publicly traded companies have to drive up revenue, drive up their share price. That's what it's all about. I'm sure many of you have made a killing in the stock market this past year, and the insurance carriers have made a killing as well. It shouldn't be off the backs of your hardworking people. That's the problem. Okay, if you've invested in the big box insurance carriers, God bless you, because you've made a ton of money. But your people are suffering as a result, and we hope today you'll understand why. This is the first start of it. Let's talk for a moment about what being fully insured versus what being self-funded means. So on the left-hand side of your screen is a fully insured plan, and it's got one monster benefit. It's budgetable. It feels good. Even though it might go up 10 or 15% a year, it's easy. It's hitting the easy button. Your consultant comes in, they show you a few options, you make a few changes, you raise the contributions, raise the deductibles, bam, done. The problem is you're just putting a Band-Aid on it. You're not actually lowering the cost of claims. You're not doing anything that's controlling the cost of your premium. Premium is derived from claims, but it's budgetable, and that lets lots of people sleep easy at night. There's this perception that self-funding is way too risky because it's not budgetable. I might have claims of $5,000 one month and claims of $500,000 the next month, and I couldn't afford that. That'll bankrupt my company. I agree. So self-funded companies of all different sizes typically buy two types of stop-loss insurance. One's called specific stop-loss, and one's called aggregate stop-loss. I'll take a deep dive on these for just a moment. Specific stop-loss stops losses on each specific member. So just like a property and casualty insurance product that you might buy, or a homeowner's insurance product that you might buy for your house, you're going to be willing to pay a certain claim deductible on each member of your health plan. And then once that claim threshold is met, the specific stop loss pays all those claims for the rest of the year. So specific stop loss stops your losses on each specific member, set at a claim threshold that you choose in advance. Some employers might want to set that at $10,000. Some really large employers might want to set that at 100,000, 200,000, maybe even higher, because they have the money and they have the background historic claims experience to be able to forecast how many members are going to incur high cost claims. So point being, specific stop loss stops your losses on each specific member. So the other concern you need to have as a self-funded employer is, what if none of my people hit the specific stop loss threshold, but all of my people get COVID? And so I have lots of medium priced claims, but no high cost claims. Well, that's where aggregate insurance comes in. So aggregate insurance aggregates all those claims for all your people, and it draws a line in the sand. That line in the sand is illustrated by this blue box, this light blue box. When you move to a self-insured arrangement, you know exactly what your claims risk is. And then all you have to do is add in the cost of the stop loss premium, the cost of whatever network Wellnet and Sapoznik have put together for you, and then the cost of administering the whole program. Everything is known in advance, and everything's 100% transparent. Whereas over here, you have no idea what anything costs. All you know is that you're paying $1 million a year, and next year it'll cost you $1.1 million. On the right-hand side, you know what every single thing is. You know what everything costs, and you can control it. Just like your business, as I said before, what you can see and understand, you can manage. But as you all know, you feel completely out of control in the fully insured market because it cannot be managed. There's not enough data. We're going to give you the data to control the plan and manage the plan. There's this concept I'm going to introduce now and mention again later called level funding. This is kind of like self-funding on training wheels. So level funding is where we take this whole concept right here and then invoice it to you on a flat budgetable basis. So over here, let's say for the sake of simple illustration, you're paying $100,000 per month, 1.2 million for the whole year. That's the same Wellnet would invoice you for on this side of the table, except I've incorporated all the things we talked about, but I would invoice you 100,000 per month. But when I send you that invoice, you'll see the breakdown. And then each month you're going to get reporting that backs all that up and says, even though you paid 100 grand last month, your people only spent 60 grand. And you're going to be doing your happy dance in your office because you're going to be saving so much money. Now, if the plan's running poorly, you will have paid 100 grand and maybe we paid out 110 grand. But you'll see that there's no surprises. And Rachel and her team and Wellnet are going to work really hard to make sure when it's all said and done at the end of the year, you perform better than what you did fully insured. And so we're going to talk for the balance of our time today about the tools that we use to make that a reality for you. To add a little bit more color to who Wellnet is, we are a truly independent health plan administrator, also known as a third-party administrator, that builds health plans that compete with the big national insurance carriers. We're in our 26th year of business, so this isn't new to us. We're a privately held company based out of the Philadelphia area. I think our greatest value proposition is being able to meet employers right where they are in their healthcare journey. Some of you on the call might already be self-funded, and we've got a great platform that we can take your plan to the next level. But some of you might be scared to death about self-funding, and level funding might be the right platform for you. So we can meet you right where you are and then build health plans that allow you to evolve your plan in ways that make the most sense for your unique organization and at a pace that makes the most sense for you and your people. As an independent administrator, we're not beholden to shareholders or vested interests, only you and our consultant partners like Sapoznik. We help you turn what today is your second or third largest drag on your revenues and turn it into your company's most efficient business unit. When you start to view healthcare like a business unit, you realize the potential. I'm sure most of you on the call have highly paid managers managing less costly divisions in your company than what your health plan's costing. And so we allow you to turn your health plan into a manageable business unit. Again, I didn't mention something on the prior slide, but it's worth reiterating. This platform, fully insured, you're in a pooled claims environment. That means that the premium you're paying is not based on just your claims. The premium you're paying as a fully insured employer is based on the claims of, let's say, Blue Cross's whole book of business. In the Wellnet model, the premium you pay, the stop loss premiums you pay, the claim costs you pay, that's only based on your people. And so when we really start to hedge your bet and create programs that lower the cost of claims, lower the out-of-pocket for members, and improve the outcomes they're receiving, there's a direct correlation. When we save you $1, you save $1. If I lower your claims by $1,000, you just saved $1,000. There's a direct correlation. That's really important. I mentioned earlier, I'm going to show you the cost variance in Southern Florida. And so let's start with this. First, let me describe what a DRG is. A DRG is a diagnosis-related group, and hospitals get paid. A DRG payment is a flat payment made for very high cost, but high common, oh my goodness, very common medical procedures. So high cost, very common. And it's replacing what otherwise would happen. So if there was not a DRG in place and I needed a knee replacement, for example, the itemized invoice for a knee replacement might be 25 pages long of all different procedure codes because of all the things that occur during a knee replacement. But that can get way too confusing and way too unwieldy for both the hospital and the insurance companies. So they standardize it into a flat payment for every hip and knee replacement. So DRG 470 is showing you just that, the costs that these hospitals are receiving for performing hip and knee replacements in Southern Florida. This orange bar is the quality of the hip and knee replacements offered by these hospitals in Southern Florida. So the best performing hospital for hip and knee replacements is Kendall Baptist. But Kendall Baptist, on average, is getting paid by the PPO networks like Blue Cross about $100,000 for every knee replacement. Westchester General, for hip and knee replacements, is still pretty good at it. But they're charging almost $40,000 less. I want you to think about you and your families for a moment. You have no idea where to go for good health care. The way we all do it today is we go wherever our doctor says. What we don't realize is that most of our doctors today are owned by a hospital system, or their United Healthcare owns more doctors than any other entity in the United States. Think about that. I'm not suggesting that you don't listen to your doctor. I'm not suggesting that at all. Remember, everything we're talking about today is voluntary. All I'm suggesting is, wouldn't you and your families love to know if you needed a hip or knee replacement, who does the best? And then wouldn't you love the option of not having to pay your deductible for it? And that's what Wellnet and Saposnik are offering here. We're saying give your people a voluntary option that offers to completely get rid of their deductible if they're willing to use a high quality but a fairly priced provider. And Wellnet's advocates hold the member's hand through the whole process. All the members need to remember is call Wellnet if I don't want to spend my deductible. And then we talk them through the whole thing. So cost varies dramatically in Southern Florida. Quality varies dramatically all over the United States and in every town. There's another really important bar I want you to look at here. The blue bar is what Medicare pays. It's the Medicare DRG for the same exact thing. So think about what I'm about to say. At Kendall Baptist, Blue Cross, and the other PPO networks are paying about $100,000 for a hip or knee replacement. Medicare is paying that same hospital, which Kendall Baptist happily receives because they don't have to treat Medicare patients. Treating Medicare patients is a voluntary option by providers. They're happily accepting an amount under $10,000 for a hip and knee replacement. This is the opportunity. I mentioned direct contracts earlier. Wellnet has thousands of direct contracts that we've coordinated all over the United States. I can get hip or knee replacements ranging from $10,000 to, let's say, $25,000 in every market in America. You can offer incentives to your employees on a voluntary basis that waives their deductible when they use certain high quality but lower cost providers. And so let's say I could get you a hip or knee replacement in Southern Florida at a high quality provider for $25,000. No matter where your members went on a PPO plan, the lowest you're going to spend is $55,000. We're delivering it at $25,000, which will affect your premium. Your premiums are based on your claims. So I'm showing you how to lower your claims, remove the member out of pocket, and improve the outcomes that the members are receiving. The opportunity cost of not doing this is reflected in the 10% renewal increases you get every single year from the fully insured carriers. That's the opportunity cost. And compound that over time. Your rates are doubling every 10 years or every 7 years if you're getting a 10% increase. Our clients, their rates are held. Some of our clients get reduced renewals. Our average renewals were in the low single digits the past few years. And it's because of ideas like this. So this DRG 470 is hip and knee replacements. DRG 392, that's funny. This was for gastroenteritis, esophagitis, and one other thing without major complications, okay? It's the same story here. The treatment for that, the quality varies. The cost is all over the charts when we use PPO payment structures. But when we build a direct contract with a provider, on average, I didn't say this yet, but on average, the direct contracts we've coordinated are priced at about 25% over Medicare on average. So you can see Medicare's DRGs vary. So if you took the average of all these Medicare DRGs, the blue bar, Wellnet's direct contracts are averaging 25% more than that. Your people don't have to call us, but why wouldn't they? Who wants to pay their deductible if they don't have to? And who would want to go to an average provider if they could go to a really good provider? It's funny, when I am doing this live, if I was live with y'all, I would ask you to raise your hand if you thought your doctor was great. And everyone would raise their hand. And then I would say that cannot possibly be statistically true. In a room of 20, 30 people, half your doctors have to be pretty crappy. The other half are probably pretty good. Again, we're not trying to have you question your doctor relationship. I'm not telling you to not use your doctor. I'm just saying pause for a moment, because there's an option and an opportunity for you to not have to pay your deductible and to see high quality providers. This last DRG is for normal vaginal childbirth. I'm not telling you where to have your baby. That's a very personal decision. I'm just showing you as an employer the opportunity cost of not offering voluntary options to members. My wife and I are about to have our second baby, and our deductible, minimum deductible is $2,500. I would at least love the opportunity to use a provider that won't cost us anything, and so would your people. That's all we're saying. Give your people an option. I'd love to, well, your people would love to place a phone call and say, hey, where can I have my, who did the best normal vaginal childbirth? Who has the best childbirth outcomes in Southern Florida? And is there any I can use that won't cost me anything? That's what we're offering. It's very powerful. It lowers your claim costs, it lowers the members out of pocket, and improves the predictability of good medical outcomes. What you're seeing on your screen here is what Wellnet refers to as our toolkit. It's basically 20 plus different ways that we go into your health plan and surgically remove all these costs. The 7 items that are highlighted are the 7 most commonly used tools. I've already touched on a few of these, but our advocates are the ones that hold your members' hands, answer any questions they have. Most of our employers are using really strong incentives whenever members use our direct contracts, which include certain imaging centers as well. And we can even negotiate what are called single case agreements on the fly. For example, someone might call us and say, you know, I don't want to pay my deductible, and I had my baby at what turns out to be the most expensive hospital in Florida, I'd love to have it at a very high quality hospital, but I don't want to pay my big deductible. What can you help me out? And if Wellnet doesn't have a direct contract for childbirth at a high quality local hospital in Southern Florida, we can find a high quality provider, call them on the phone and negotiate a single case agreement for XYZ member, offering them the same thing I said before. The member will have no deductible. We'll pay you in a couple weeks, which is real quick. We just need you to give us a very fair price. And so we're doing all that behind the scenes, but that's the power of an independent administrator. There's two other things that Rachel said earlier that are such low-hanging fruit. If you guys watch television at night, you know that drug commercials after drug commercial run at prime time. And at the end of every single one of those commercials, you'll hear something like, if you can't afford your medication, we can help, call us. Well, Wellnet and Rachel and her team, we know which drugs have assistance programs. We know which drugs can be sourced through international pharmacies. One of the last pieces of legislation President Trump passed before he left office was allowing drug importation from Canada. We can source many medications at a fraction of the price that your health plans are paying today. But you can only do that with an independent administrator. Blue Cross doesn't allow it. And the same with assistance programs. If we can get Humira, one of the most commonly prescribed drugs that cost health plans about 60 grand a year, if we can get Humira to cover the cost of that drug, why wouldn't we do that? Well, that's exactly what we're doing with Saposnik and our employers. We're going to look at the drug utilization and offer members zero cost if they allow us to source it through an alternative channel. We're not changing the drug. We're not swapping out a generic. We're just sourcing it in a more efficient way. And the benefit to the member is zero cost. Today, because of the way you have your copays set up, whenever your members need a very high cost medication, they're probably paying $80 to $120 per month for that medication. So we're talking thousands of dollars a year for people taking multiple medications, many of which can be sourced for a fraction of the price, which means you can waive the copay for the members. These 7 things here allow us to take a Blue Cross plan that you have today, build it on the Aetna or the Cigna network with a Wellnet, and then we mirror your plan designs, and then we offer everything I've just described on a voluntary basis. Call Wellnet. They'll help you get rid of your deductible. They'll help you save money on a bunch of your drugs. So it's always set up on a voluntary basis. And there are instances throughout the year where Wellnet will proactively outreach to members if we see a glaring opportunity, like a high-cost drug. We know that families would rather spend nothing on a drug versus $1,000 a year. That's obvious. And we're not changing the drug. We're just sourcing it more efficiently. So we've got all these tools. Something I haven't said yet is this idea that we abide by called crawl, walk, and run. In life and in business, you have to crawl before you walk and walk before you run. It's kind of about stepping outside your comfort zone. We know that you're comfortable with the big box carriers, but we also know that there's something missing. So we allow you to crawl before you walk and walk before you run. So our crawl approach is what I've described. We mirror your plans, we layer on these voluntary options. As your tolerance for change increases, as your employees' understanding of the plan increases, we can move you, if you would like, down this continuum where we can constantly focus more and more on the quality of the providers we're seeing and layer in more and more of these tools to hedge your self-funded bet. The more we all work together, see, self-funding is a team game. There's no I. There is an I in self-funding, but there shouldn't be. It's a team game, okay? The more all of us engage, you as the employer, the employees, the consultant, the administrator, we're all in together. We have to create an environment that always does those 3 things. Drives down the cost of claims, drives down the member out of pocket, and improves the outcomes, the predictability of a good medical outcome by helping members see quality providers. So I've got all these solutions. We meet you where you are in your unique healthcare journey, and we work with you over time to continue evolving that health plan in ways that make the most sense. On this slide is one group. This was an auto dealer that we worked with just last year. They've been a long-time client, but this is what we did for them last year using just 3 tools in our toolkit. We took 2 drugs off the plan, which saved them instantly $283,000. Didn't take them off the plan. We sourced them more efficiently. Members still taking the same drugs. We had a dialysis member that all we did was change the way we pay for dialysis. The member kept seeing the same provider, but we saved the plan almost $700,000 because we're not using the PPO plan to pay for it. We created a special pricing arrangement. And the same for an upcoming kidney transplant. The network would have, the PPO price was going to be 325 grand for that DRG for this kidney transplant. We have it arranged at 167,000, providing 157K of savings for the employer. 1 year, about $1 million for this group. We make this all really easy, really turnkey. Wellnet's got an advocacy squad that supports members. All of our groups obviously get a dedicated account manager that supports the executive team at each of our employers. It supports Saposnik's team. And then behind that account manager are 3 different types of advocates. Our customer care advocate, which handles everyday basic questions. Our clinical advocate that can get involved on very clinical related issues. And then the most commonly spoken with advocate is the care promoter, which helps members identify quality providers and talks to them about their incentives. Most of you today are right here. You're using only PPO plans and you're hoping and praying that your rates don't keep going up. Wellnet and Saposnik are giving you the opportunity to come in right here. Give your people what they're used to. This feels all warm and fuzzy. My plan's gonna look and feel just like the one you've got today, but then we're gonna enhance it with the ideas that we talked about today. And then when you're ready, we can start to do more progressive things. For those of you that are already self-funded, we offer 3 different versions of self-funding, if you will. Traditional, I mentioned level funding earlier for maybe a new group to self-funding. And then we can also get into more advanced concepts like captives and consortiums. That's a conversation for a different day. Everything we do at Wellnet and with Saposnik is all tech focused, although we certainly print paper materials and have paper, but everything we do is all tech oriented. So Wellnet's got a variety of portals for our employer, for our consultants, for our members. We have a mobile app for members. So it's all very tight. And then you guys get all the reporting you can handle and you can pull it in real time off of our portals. And all that data, you'd work with your Saposnik team to understand it. They're the ones that would translate it and synthesize it. And then we all work as a team to build a more efficient health plan. So I can't thank you guys enough. This is a fantastic opportunity for us. Anytime we can share the wealth, if you will, and help you understand what is available, it's such a great opportunity for us. So with that, we'll pause and we're happy to answer any questions that y'all might have.
Thank you, John. You did a fantastic job.
Thank you.
Really appreciate all the education. Jacqueline, I think you have some questions there.
Yeah, I wanted to know, and I'm sure this question's on a lot of people's minds, is there any liability I should be concerned relative to recommending members to use certain providers?
No, not at all. I'd actually argue the opposite. Isn't there liability in not helping? And I want you to think about this from the perspective of your child. You wouldn't let your child try and figure out where to get their major health condition treated. You'd work on their behalf. You'd help them. You'd talk to their doctor. On some level, as a paternalistic organization or a maternalistic employer, you have to think about it like that. You don't want to be in the position where you're dictating where people have to get care, although you can if you want. You're certainly welcome to do that. But most employers aren't comfortable with that. But at the very least, you should be empowering them with data so that they can make the best possible decisions. I'll give you 2 options to answer that question. What if someone on one of your plans today saw a local doctor and had a terrible outcome and had to have 5 other surgeries? Do you feel that you have any liability there? Maybe you do, maybe you don't. In our environment, we provide the member all sorts of background information relative to the quality of the providers that they might ask about or the quality of the providers we might recommend. If it ever came down to it and a member had a bad medical outcome on a provider we recommended, we have all the data in the world to support why we made that recommendation to the member. And that's far more than what a member has today. So there's no liability at all in creating this type of environment for members. It's what they want. You just might not realize it yet. Remember, I'm not taking anything away. We're just enhancing what they have today. Thank you, Jackie.
Awesome. We have a question from Ileana. Can you have both aggregate and other stop loss coverage, or is it one or the other?
No, well, in a self-funded environment, the simple answer is an employer can do whatever they want. The largest employers go without stop loss insurance. Most employers, though, will purchase both types of stop loss insurance. There's only two types: specific stop loss, which insures every specific belly button on the plan once they reach a certain claims threshold, and then aggregate stop loss, which covers claims for the whole group once they reach a certain level. So we would recommend for most groups with less than 1,000 enrolled on their plan that they purchase both types of stop loss insurance until such a time where they fully understand the risks of going without either of those policies.
John, once you have a client with Wellnet, what has been your historical persistency?
Oh, you know what? I failed to mention that on my prior slide. So Wellnet is thrilled, and I can't believe I didn't say this, to have a 98% retention rate over the last couple of years. So when our clients move to Wellnet, they're very happy and they stay with us because we're outperforming the big national carriers. We're like David to Goliath. Nobody thought David could win, and he slayed that beast. And then everyone was like, holy cow. The other thing we're very proud of, and it was on that same slide earlier, is our NPS score. That's a score of members' perception of a health plan. Our NPS score is 82, which is about 4 times the national average of all the other health insurance companies. So our members are thrilled with the advocacy support they're receiving, and our clients are thrilled, as seen by the 98% retention rate.
What if you're already self-funded and love Blue Cross or love one of the other companies?
Sure. To me, in my own experience, I've been doing this about 17 years, 10 plus with Wellnet and with another independent administrator before that. Groups that are currently self-funded with the big insurance carriers are the easiest to convince, actually, because they see their data and they still see that they're trending up at 5, 10, 15% a year because the carriers simply aren't controlling the cost of claims. So it's actually really easy for us to prove beyond a shadow of a doubt to an existing self-funded employer all of the exact ways we would save them money. If you picture that toolkit slide I showed earlier with the 7 highlighted items, imagine us being able to drop that toolkit on top of your historic claims data. Rachel and I are actually doing this with another employer in Chicago as we speak that almost has 1,000 enrolled. They're fully insured with Blue Cross, but they were able to get enough data that our team at Wellnet analyzed all that data, and we went back to them and said, here's the exact ways we're going to save you guys almost $2 million in claims. We identified every single exact way we were going to do it. And so groups that are currently self-funded, what a huge opportunity this is. You've already taken the biggest leap, if you will, going from fully insured to self-funding. Now, how do we work together to make your plan a high performance health plan rather than just, your average health plan, if you will?
Wow. I just got another question from Ileana. What information is needed to begin the process?
Sure. So it's very easy for Wellnet to put an administrative proposal together. I don't need much more than a census to do that. But any group that should consider being self-funded is going to need that stop loss insurance that I described before. And so to obtain stop loss proposals, and we're agnostic to where that comes from, we'll shop them on your behalf, the different stop loss carriers. And Rachel and her team can also shop different carriers if she would like. But in order to shop stop loss, we need detailed historic claims information. And to keep this answer simple, if detailed historic claims information is not available, we do have a couple other ways that we can obtain that data, but we'll talk about that on a one-off call with anyone that's interested in learning more.
Got it. And then I don't know if anyone else has any questions, but in the meantime, my last question is, what networks do you guys work with?
Sure. So Wellnet can offer the Cigna PPO network or Aetna's largest network, which is, it operates like a PPO, but it's called the Choice POS 2. Simple answer, Aetna or Cigna, and then we can build any type of plan design you would like. We can custom build the plan designs, but the network would be Aetna or Cigna, and our ID card would show the Aetna or the Cigna logo for members to feel comfortable with and for providers to feel comfortable with.
Awesome.
Okay, well, I think this was a great informational webinar, and I really want to thank everyone. I appreciate everyone's time in listening. As Jacqueline had mentioned and Megan had mentioned, you will be receiving the information. You'll get an email. And if you're interested in having more information about this, we'd be happy to visit with you and provide a one-on-one consultation for your business, for your employees, and see how Wellnet and Sapazza can provide to you solutions that not only help you on the benefit side, but also help to reduce your healthcare costs. John, any final thoughts?
No, other than thank you all so much, and we look forward to re-engaging after this call. Thank you.
Have a wonderful day, everybody.
Thank you,
Thank you.
John.
Bye.